I'm trying to record a podcast. Hey everybody, Angela Ardolino with Your Natural Dog, and I'm so excited about my guest today. It's Dr. Jannine Krause, who is a naturopathic doctor, acupuncturist, herbalist, and hardcore dog lover. And today we're going to be talking about the difference between what a naturopathic doctor is and a holistic doctor. Do we have naturopathic doctors in veterinary medicine? And we're also going to talk about how our dogs mirror a lot of times what we're going through, whether it's an ailment, a disease, a disorder. A lot of times our dogs mirror what we're going through. So we're going to talk a little bit about that too. It's a great conversation. Stay tuned. Okay, and we're back with Dr. Jannine Krause, and we're talking about, like, my mind is blown because naturopathic doctors, which is what you are my favorite. Yet, when we go over to the animal side, that doesn't exist. So first, tell me, what is a naturopathic doctor? How it's different than would you say, a conventional doctor?
Sure. We are, a naturopathic doctor compared, and I usually do the comparison because it kind of helps people to understand. I have had the same amount of training as a medical doctor. We have a base foundation of 4 years of school. We have a residency, but the residencies, while we're in school, they incorporate it in with us. And so instead of afterwards, like the conventional medicine spaces, we do it within, and it is optional. So that is something that is a little different. But by the end of school, we have a certain amount of hours that we have had hands-on with patients, but also within clinics that are outside. We have to go do outside clinic work too. Now, that's the foundation. The main difference between my training and a medical doctor's training is that I have a whole year of nutrition. We have whole foods nutrition.
What?
Yes.
What a concept. And those of you who do listen, I bring this up all the time. I have interviewed so many veterinarians, and I always ask them, how much education did they get in nutrition? I've had one say none, where she said that they were supposed to, but they ran out of time, and that's what got cut from the curriculum. And then others who were like one 6-hour course. So yes, what a concept.
A whole year. And not only that, in addition to that whole year, the school I went to was Bastyr University up in Seattle, and we would go out to the garden because we had a garden for the school. We had an herb garden and a plant garden. We would go out to the garden, and we would bring it in, and we would cook with the food. And then we would use the different herbs in the food, all that stuff. And so we were also harvesting from our plant garden and doing herbs too. So of course, we have the year of nutrition. We have 4 years of botanical herbs, like stacked up. Every herb out there, unless it's something that's been, discovered in the last 18 years, because I've been in practice 18 years, we did it in school. We knew all about it. And then we have a year of counseling. So we're going through a whole year of learning how to counsel people with making lifestyle changes. There's stuff they're dealing with, anxiety, depression, much of what a traditional counselor would go through. Granted, we only have 1 year of it. So we're learning that too. What's a little difference in terms of natural medicine is we do learn emergency medicine, but not to the extent of like what we would see in terms of the ER or something like that.
Right.
A naturopathic doctor is not the person you want, like on the airplane when they call, like, is there a doctor on board? We're not necessarily your best choice in that case. One, because we just don't learn all the extreme emergency medicine stuff. But can I do minor surgery? Yes. Can I, remove a lipoma kind of minor surgery? Yeah, absolutely know how to do it, done it before. Can we do IV therapy? Yes, if we took the class for that and had the certificate. They now teach it within the curriculum, but when I was in school, we had to go to extra training to get the IV certification. And I chose not to, just wasn't my jam. I was much more into food and pain medicine and acupuncture. So out of those, 4 years at Bastyr that we're supposed to have, I took 6 because and I just wanted to be there longer, but I also did acupuncture at the same time and Chinese medicine.
Neat.
So I have that background too. So not only do I have the Western herbs, which a lot of the Western herbs are Chinese herbs, they just have different names. really? So I know the Latin name, the common name, and the Chinese name of many herbs. And so we did a lot of that. And then really the only other thing that I would say is really different is that we learn about homeopathy. We learn about physical medicine, so hot and cold and like bath types of therapies, peat moss types of therapies, different things of that nature where you're not going to get that in conventional, training. But I've had, people will argue and say, well, naturopaths haven't had pharmacology. Yeah, we have, because I can prescribe in Washington State and in Montana. And so I had pharmacology, I had immunology, I had all the ologies you can imagine. We had a whole year of cadavers and anatomy and physiology, which was my favorite part of class because I can really see what's going on in the body. But yeah, our training is different. And it's more based towards the herbal side of things and the alternative options that we have out there.
Which they should not be called the alternative because they are the original medicine. And man, when I hear you describe your education, that's what I think most people think all doctors get.
Yeah.
And they don't get that at all. What you described sounds dreamy to me. This is who I want to go see. This is who I want my pet to go see, because you truly did get a full education, full rounded education about both sides, pharmacy and natural medicines, the original medicines. Mm-hmm. When our conventional doctors are taught very little about nutrition, they're mostly taught about how to write prescriptions. This is the ailment. This is what it is, what it does. And here's the drug you take for it, and or emergency medicine. They're not taught how to keep us at homeostasis and keep us healthy. So man, what a difference. And then I think what breaks my heart is that this doesn't exist in the veterinary field.
No.
Our choices are conventional. And if we go to a holistic, they've been trained conventionally, and then they have to continue their education to learn all of these things. So they would have to take a separate nutrition, separate Chinese medicine, separate acupuncture, separate herbal, separate homeopathy, all separate that they have to take and learn all of these things. When we all wish we could go to someone like you. In my opinion, and I don't know if this is your opinion, we should be able to go to the same person because we have so much in common with our dogs and our pets. We do have the same body systems. We do both have an endocannabinoid system. So to me, wouldn't it be great? I know one of my favorite things about you is that you said your dog is often in your office with you. And I'm like, oh my God, I think I would die of happiness if I walked into my doctor's office and a dog was there in the office also.
Yeah.
So what does this mean, man? Like, how do you take care of your own dog? I mean, I know we just shared a story about you going, okay, I know what to look for. I'm going to go look for a holistic vet. But even you,
a
naturopathic doctor, had experienced what most pet parents go through. Talk about that a little bit.
Yeah. So when I moved back from Washington to Wisconsin, that was my first thing. I wanted to find a holistic vet because I had a great gal in Washington. She did a lot of telehealth with us. We did, lots of care. She was on her own, not in a very big clinic. And it was a great experience. And so I was like, okay, I want to mimic this. But at the time I had two dogs. I had my golden retriever I have now, and I had another dog who was a rescue that I was told he wouldn't live more than 6 months. I got him to live 2.5 years. Beyond taking care of him, eventually passed it was a tough case, but my intention was originally to have him go to the holistic vet to help me out, kind of give me a backup here because, you as a naturopath, yes, I learned all the herbs and things, but I didn't know everything about, dogs anatomy. Right. And I wanted to have some background. So long story, short, that dog's name was Toby. He passed, but I still have Brian, and Brian was having some ear infections, and we were kind of going back and forth on different herb options, and the vet would give me different herbs, and we would try the different herbs that were really, when I look back at it, labeled for pets, but it was the same formulas that I would have used in humans anyway. So I was like, well, I could do this, but
not to interrupt you, but what happens all the time is that we'll have a company have a human product and then they go make a pet product and they literally cut it in half as far as potency because they don't really know animals or, they think people aren't going to pay the same amount of money as they would for a human thing. So that is very common and happens a lot. And you're like, what? No.
Well, what's even funnier, this is the flip side to that is I'll have patients who come into me who are taking the veterinary versions from companies because they saw it was cheaper. And so they're like, well, this company put out a pet version of this and it's the same that was in my human one.
And is it the same? It's not, right?
It's half the dose. Like you said, it's either a third or half of the dose. And so they're like, so I just went with the vet version. And I'm like, what?
Well, you should probably not do that because they don't give a shit about our animals. So it's not unregulated. Our animals are considered property. So yeah, unfortunately, I used to be a practitioner for a mushroom company. And when they released their pet products, and I went and I knew the person that formulated them, which he didn't because he doesn't know shit about mushrooms. And when I asked him, he said, oh, well, there's no research out there for dogs and mushrooms. So I just cut the potency in half. And I'm like, A, yes, there is. And B, not fair and not okay. Price stayed the same, but was half the potency for that reason.
Oh, man. I hate to hear that. I'm asked all the time because people, are looking for advice. And so I'm asked a lot, like, hey, can my dog take this? And yeah, I don't see any reason why not to. But when I went to this holistic vet, I had it in my head, like, okay, I had looked at their website. They had all the right keywords, and you don't know till you walk in there. And when I walked in there and I saw the Science Diet, promo on one side and Bravecto or whatever was the, thing at the time for the tick and flea, I was like, oh. And so I asked the front desk person, I said, oh, is this the office of so-and-so? And yep, it is. I thought this was a holistic vet. I literally was like, I thought this was a holistic vet. Oh, well, we have other vets here too. We do all the things. Oh, okay. So you're like in what I joke as an integrative medicine clinic, wink, wink, integrative, right? That means you maybe have,
what do you want? We got it.
Right. We'll integrate all of it. Yeah.
Whatever it is that you're looking for, we got it.
Tell me what you want. So yeah, we took Brian in and Brian was dealing with the ear stuff. I just wanted to know, like, if I was, a little advice on a pet, how high can I go? Like, that is the thing. How high can I go on some of the washes I was using for his ear? I was using silver and,
good.
We had used Manuka honey and some other things from different scratches that he had too. And I was like, well, could Manuka honey, I don't know. Right. So I'm like throwing ideas and like, I got a deer in the headlights look. And what had happened is like, I got a couple of suggestions and okay, we off I went with some herbs that I could have figured out myself because it's the same we use. I go back home. We put Brian on a very strict diet. He's eating just what we eat. He's eating, meat. I couldn't do as much of the raw just because of life. I had to juggle things, but he's eating what we're eating and he lost weight. He probably lost, no joke, about 15 pounds and he looked good. He was fit. He's good. And I'm saying he still is. And we went back in and when I brought him back in, the gal looked at me and said, what have you done with him? And I'm like, well, he doesn't have his problems anymore in his ears. His ears are good. I'm here just to check.
What you're saying is that you fixed the problem with the diet, you fed real food, and you figured it out, and the ear infections went away.
Yeah.
And so now you go back in, and they're going, huh?
Yeah, I pretty much was like stared down and said, what did you do? And I said, well, we stopped feeding him his kibble. We, and of course I had tried to get the cleanest kibble I could. And, I had went through a bunch of different things and it landed at, I was juggling just for dog, the food for dog, like just for dogs. And I was juggling my own food and he lost weight and they took him away from me while I'm sitting in the visit. And I know being a doctor at that point that they think that I have abused him and I've starved him or done something crazy. And I'm sitting there like, are you kidding me? And I was being drilled about the food in the first place. And
this is a naturopathic doctors being treated this way. So I just want you to keep that in mind, that when you feel uncomfortable or not heard or judged, they're doing this to a naturopathic doctor. So if they're doing it to you too, leave, get out of there. You should be respected. You shouldn't be pressured into anything. You know your pet better than anybody. They do not know your pet better than you. And if they prescribe and give you something that you then give to your dog and it hurts your dog, it's your fault, not that veterinarian and not that doctor's fault. You have to be your pet's best advocate. You have to go home and do the research. I don't even accept it before I leave the vet office. They're always trying to give me a med or something. And I'm like, no, not doing that. Last time I sent my partner to go get the dog's teeth clean, and he came back with 12 vials of some antibiotic that they gave him to give something else that they said the dog was suffering from. I'm like, I made him drive back and give it back and get our money back. No, we're not doing that.
Oh, yeah. Yeah, I didn't even get to the, like, when we talked about this before, I didn't even give you the full story on what happened after I got him back. I mean, because after she had basically told me that I didn't have enough, where did you get your research on what food portions to give them? I said, well, actually, Stanford University has a whole, program on what you can feed dogs when you feed raw and when you feed different portions and whatnot. And I said, and I was actually following the advice of my holistic telehealth doc in Washington State. And I said, so I wasn't just willy-nilly giving them food, first off.
Right.
And so then it got a little heated. They took the dog, they took Brian out. And my husband's looking at me and I'm like, they think we abused him. That's what's happening right now. And, we're sitting there, 20 minutes goes by and I'm like, if they don't give him back, then I'm going to go get him at this point. And so finally he comes back. They're like, yeah, he looks okay. Yeah, the ear infection's gone. Everything seems to be okay. I'm like, did you find any breaks and bones? Because at this point I was combative a little bit. And I was like, so you think I abused him? And the gal's like, no, not at all. I'm like, well, yeah, he's better. So I just wanted to make sure that, one, I was kind of there to show that he got better. But two, I was also wanting to know, like, okay, what's my next steps here? Did they have any other advice for me? The only thing, speaking of the vials, she was like, well, he's not up to date on his rabies vaccination. I said, well, I'm not getting him a rabies vaccination. I'm like, at this point, all of his issues actually kind of started after a previous vaccination. And I said, at this point, I'm never giving him anything. And she's like, well, we're going to need you to fill out all this paperwork. So they handed me paperwork and a signature. I had to sign to say that I refused the rabies and it was my fault if anything happened. And I'm like, that's fine. I will take that. I just don't want him to have this ever again.
Yeah. How much sense does that make to you as a naturopathic doctor that people go in to see their vet because their dog is sick and the first thing they do is come back and go, oh, he is not up to date on his vaccinations. We should never be giving a sick dog vaccinations. Doesn't that blow your mind?
Blew my mind. I mean, what is an ear infection? In if I'm looking at my human patients, what is that? That's a lowered immune system. So I'm going to go and give him a vaccine to wreck his immune system more? I mean, no.
Makes no sense.
And of course, the gal walked out of the visit on me. She wasn't very happy with me telling her how I felt about things. I've never been back. I won't go back, for obvious reasons. And at the end of the day, it really left me thinking, like, I can't trust this holistic designation because sadly, I felt like I knew more than the holistic doc. And, I never went to vet school. I've thought about it. I really have.
Don't waste your time.
Exactly. I don't want to go and listen to a bunch of, I would have no joy in life because I'd be listening.
You'd be going, how much money did I spend on this shit?
Right. Why did I do this? And it makes me mad. The other side of it is because I'm an acupuncturist and I would love to do acupuncture on pets too. But now we have this whole thing, like you have to be a veterinarian or you have to have, somebody. And it makes me sad because I'm like, if I could do that, if I could see pets, I'd probably be so happy on top of seeing humans, at the same time, because as I shared, I love to let people come in the office with their pets because they're healing. And when I had the pets in the office in Washington, I mean, people just loved it. And it just seemed to be so soothing, so therapeutic. And when my partner in Wisconsin has her dog in, like, it's just, everybody has a better day at the office.
Yes,
not that we have bad days, but it's just they light everything up. And so, I think at the end of the day, I will find some way, to have the pets involved. And I think this just has me a little bit more of a fire lit under my butt to be like, all right, if people ask me, like, could my pet take this, and what would we give them? We just look it up. There's plenty of info out there. We just look it up and go, all right, this is what I'd recommend. Watch them, see how they do. That's all we can do. That's what we do with humans anyway. That's practicing medicine. We're practicing because we don't necessarily know 100% either way.
Right. And I know, yeah, exactly. We're practicing. And what I love is that I know people listening would agree with me. Nothing would make me more happier than being able to go see a naturopathic doctor with my dog. And that being said, let's talk about how our dogs mirror what we go through and why it would be so appropriate for me and my dog to come see you, especially if we're suffering from some of the same ailments. Now, this may sound like super woo-woo to people, but I went ahead and looked it up. And there are multiple pieces of research showing that this is true. I also experienced it myself. I was diagnosed with rheumatoid arthritis the very same time that my soul dog was diagnosed with degenerative myelopathy. That's, to me, not a coincidence. And then I ended up making us, after going through my education and everything, making us the same remedy to help our ailment, and it worked. It's Odie. He's on the Ease bottle. But
Demo.
Let's talk about that.
There he is.
Love it, love it. And that's why I think that's how I fell in love with you. Is I follow you on social media, and you have an amazing podcast that is awesome. And oh my God, I loved I think it was your perimenopause one was so much fun because she literally went through all the tests and which ones you should take and, whatever, because everything is so confusing. Yeah. But yeah, let's talk about this mirroring and how oftentimes what we're going through is what our dogs are also going through. Also, has this something that you've seen? Have you experienced this yourself?
Over and over again. Yeah. Awesome. When I'm down, it seems like he's down. Brian's down. My other dog, Bear, he was kind of, I'm going to call him my soul golden, because he and I just were buddies and went to work with me every day since he was a pup. And he was my therapeutic dog. Brian is a little more hyper, but Bear just got people. And he would come with me. When I started to feel off and really stressed in the office, I started to notice that he was getting down and a little agitated. And by that time, he was a senior dog. And, I didn't really realize how much it had impacted him. And I do believe that he ended up with cancer because of our energies, and me being in a really rough place in life at that time. And I didn't know what to do at that time for him. Yes, we were giving him herbs. Yes, there were different things, but I didn't do any hemp at all at that time. There weren't mushrooms involved. It was more on the lines of lemon balm, so gentle kind of adaptogenics. I grew a lemon balm in my backyard at the time. And so anyway, the connection with it, I would see when he was sad, I was sad. When I was anxious, he was anxious. Brian feeds off me when I'm anxious or angry. And if I'm saying the F-bomb, Brian's running. And so
Maza does that too.
Yeah, like,
moment. I literally now I'll look at her when I start getting heated and whatever, and I'll look and I can see her starting getting anxious and leave the room. And I'm like, it's okay, Maza, it's okay.
Yeah, you almost have to be like they can feel it, right? Their energetics are so much stronger, so much more in tune than most humans. And if I'm having an insomnia kind of night where I'm not sleeping because I've either had hot flashes or I'm just night sweats or my brain's going or whatever, he'll often come in with me and will stay awake and just lay next to me and kind of cuddle and be like, I know, I can feel it. And this is why I say menopause, PAWS, because I do think this is the time to get tight with your critters. Like horses, I see so many patients that have horses and donkeys and goats, and they're like, yes, they're my buddies. And I think this is the time that we really can tap into looking at our animals and go, okay, how are they doing? How am I doing? How can we both treat each other? And that's why I loved your concept of what you make for you, your pet can have too. And I know you've done the work, right? And that's where we're not guessing, because I would hate, for me, one of the reasons I didn't become a vet is because I probably cry every day seeing how, people were giving their pets the cheapest dog food out there. And I get it, there's finances, there's this and that, but it would, for me, all the pet.
Well, it's not even finances. It's what you're made to believe is normal. Right. We were both brainwashed. I'm not judging here. Yeah. I fed kibble at one point also because my first dog I lost at age 7 because I lived across the street from a conventional vet, brand new, state of the art. It was so fancy. I literally went over there and said, tell me everything I should do to keep this dog alive the longest. And guess what that protocol was? Flea and tick poison every single month, heartworm poison every single month, feeding the shitty kibble every single month. And, at age 6, she started throwing up and having diarrhea. And I go in, they have no idea what to do because they weren't taught anything about diet and nutrition or the endocannabinoid system. $15,000 later, I had no business spending that money. I still don't know what's wrong with her, and now she's dead. I even got an autopsy done. They came back with IBD. I'm like, so now I know. Now I know. I think it's really effed up that I know more than a doctor knows. How is that possible? Like, I don't understand, and this I'm sure goes through your head too, is how does a conventional doctor or veterinarian continue to practice when they are not seeing animals get better?
I don't know. I mean, I've questioned that in my practice too. When I don't see improvement, I'm going, something's off. I always believe that with humans compared to dogs, we have to care for them. Humans, we have the choice to take care of our own health care. We also have the ability to heal within. Right? Our energetics, we can work on that. But I also feel like if our energetics are affecting our pets, we have to think about that in terms of their overall health. I truly do believe that I had some impact in Bear passing. I do. And I know that sounds crazy. I'm giving my power, whatever, energetics people want to think of, but we need to be thinking about this connection there. But it is wild. We know our bodies, like as humans, we know our bodies better than any doctor does. We absolutely do. I'm only here, I see myself as a guide. But when I'm not seeing someone improve based on my recommendations and the interventions that they're doing, we got to look elsewhere. We got to keep looking. We got to figure this out. We can't just keep doing the same thing over and, and expecting this, something to
That's insanity.
That is insanity.
That's the definition of insanity. That's what makes no sense to me. And then worse is when they do have someone, well, and just like me, when I was diagnosed with rheumatoid arthritis, the only option I was given was Humira.
Yeah.
I wasn't taught about my diet. I wasn't taught about epigenetics or the environment or anything in my environment that they might be making me sick. I was simply handed a pharmaceutical drug that had already been linked to lymphoma. So I'm going to get cancer so that I could stop the pain from my rheumatoid arthritis. That doesn't make any sense. And then worse is when this happens in vet and they go, oh, your dog has cancer. Your dog's having seizures, your dog's lost mobility. I would consider euthanizing them.
Yeah.
What? And then the dog comes back 6 months later at homeostasis, no more cancer, doing great. Do you think that vet asks for my name and number?
Nope.
I have never gotten a call from a veterinarian going, could you please tell me and teach me everything that you did with this? Never. I get told, pet parents tell me, I told the doctor all about you and about your products and whatever. Why not? And I get it. You're very busy or whatever. But if you were to walk in and you gave someone the diagnosis that they were going to be gone in 4 months and it's a year later and they're still there and they're thriving, wouldn't you want to know?
100%. I would be like, you're coming on my podcast. I want to know what you did.
Exactly.
Like, tell the world. Yeah. Yeah. I don't, unfortunately, I don't know if it's ego in the conventional medicine space. There's a lot of that too. I don't know. I think I have no idea, but I guess at the bottom line, I mean, I would want to know exactly what someone did, and I'd want to know like the whole protocol, and I'd probably use it a couple times and see how it worked on my end, and heck, if it works. I
And
mean,
that's the way it's supposed to be, right? You're literally doctors take an oath to do no harm and to continuously learn, and then whatever they learn, pass on to others. That doesn't happen. Sounds nice, but it doesn't happen. You and I do that all day long, but they're not doing it. And what I want listeners to realize is that we don't have that naturopathic option in vet med. We have conventional vets that do, some of them go out and get additional education, but the majority of them are using the words integrative and holistic as marketing terms. They're getting you in that door because they know you've read something on Google or heard a story, and so they want your money. But if they are just hawking and giving a prescription and reminding you of a vaccination when you're bringing in your sick dog, or you see that flea and tick, or you see that science diet on the shelves, you are not in a holistic practice.
Yeah, I mean, it's sad. It's sad. And I see it too. You know, I had a podcast earlier where I talked with a holistic dentist, and it's the same thing in that industry too. This whole thing of holistic, it's, you know, a lot of people ask me, what's the difference between you and a functional medicine doctor? And a lot of people call them.
Oh, what is the difference?
Yeah, great question. Because a lot of people call themselves functional medicine doctors, but they're not doing, or functional medicine practitioner, and they're not doing what, you know, it really is. And so the difference between is functional medicine is meant to kind of look root cause medicine and dive in deeper. Traditionally has a lot of like testing behind it, lab testing and supplements on that end, and much kind of what I've done. But what I find with functional, depending on the training and depending on what someone's into, there's not as much herbal medicine. Some places will do some energetics, but a lot of times what it is supplements and tests. And I can't speak for everyone. I don't want to offend anybody that's doing other things, because I know there are a variety. But the foundational functional medicine is doing the tests to see what's going on, a lot of genomics, all that kind of stuff. And then there's a protocol, and the protocol often is some nutrition, of course, is going to be in there. There's going to be some supplements in there, and there may be higher end, I call them biohacking types of devices. You know, maybe there's some like full body red light therapy. Maybe there's IV therapy. Maybe there's some of that. Maybe there's peptides. Not that I think any of those are bad. I think they all have their purpose, but that's what we'll end up seeing with more of a functional medicine approach. And some functional medicine docs are incredible. And there's other folks, same kind of thing, just saying they do this and they don't. And there's other folks who label themselves as naturopathic doctors, and they can, based on different states and legalities too. This is something to also look at. Ask, you know, find out where the doc went to school. Find out if they took a board exam. If they had to take a board exam to graduate and they went 4 years, they went to an accredited naturopathic medicine, naturopathic doctor school. If they have a certificate that they got from a school where they went to school for 6 months, in some states, they can call themselves a naturopath, which some of these folks.
So you can be a naturopath and a naturopathic doctor.
Yes.
Wow.
Yep. In Wisconsin, we have folks that we call them limited scope naturopaths. And these are things where these folks have taken a certificate course. There's a school in Michigan that does that. No disrespect to the school. They do teach really solid information. I think we do need this information out there. A lot of these folks are solid in what they know, but the only thing that we're not seeing is a more in-depth understanding of physiologies, the ologies. They haven't had cadaver. You know, maybe they went to a group course for a weekend and saw the cadaver. They didn't do it a year. And we don't see the amount of pharmacology and understanding, you know, drug herb interaction and things like that. But like one of my dear friends, Dr. Anna Marie Frank, is a traditional naturopath. She did one of those programs, and she's great. The gal is, you know, knows exactly, like, I would just call her like your honorary naturopathic doctor, because you can do what I can do. But there are some folks that are a little misleading. And so at the end of the day, what we want to be thinking about any of these places, much like when I went to the holistic vet, you just got to go in there and see for yourself and get the vibe. And what I didn't do, because I didn't live in the town where the vet was, I couldn't just pop by. I was taking a chance. Do a drive-by, go in the place versus just call. And look at what's on the walls. If you see, you know, a huge thing of supplements, but you don't see any herbs anywhere, maybe a red flag. You know, my clinic up in Wisconsin, we don't have it out. You can't see all the herbs. You can't see everything. It's just nice and soothing. So that is kind of a little misleading, but you can ask the front desk person. They're going to give you everything you want to know. Ask them, does the doc prescribe herbs? Do you see herbs come out? They're going to tell you very quickly. So I recommend that everyone goes into any of these practices and stop by. The only problem we have now is that a lot of people are telehealth. And so taking advantage of a 15-minute connection call and seeing what you think and asking the questions, finding out kind of some of the training, those things that if it's not online, they haven't put it out there, then you want to dive deeper.
Because remember, guys, it's nobody's responsibility but your own. So if you look up that doctor, go to that doctor, get the prescription or the injection or whatever it is, and you didn't like it, or you're not comfortable and your dog gets sick or your dog passes, it's your fault.
Yeah.
It's not that veterinarian's fault. It's your fault. And I know that's hard to hear. I'm the reason that I lost Lucy at age 7 because I put her health in someone else's hands and blindly trusted them. I didn't do my homework. I did not look at the side effects of what the drugs were that they were prescribing or the flea and tick meds. Now I do, and I want to cry. Yeah. I want to cry that this is allowed in the country that we live in. And because you guys didn't remember, these flea and tick pesticides that you put in and on your dog, they get on you too. Literally in Europe, I can't remember where, so I'm just going to say Europe. They've literally outlawed them because they realized that they were polluting the rivers and ponds and lakes because the flea and tick pesticides were coming out through their skin, getting in the water, and all these fish started dying. So they tested the water and linked it back, and now those pesticides are illegal. Yet here we put them on all the time, and they're getting in and on us, and what they're doing to our pets is just really awful. It's literally like giving them a pesticide. And there are better ways. There's not an easier or more convenient way of getting rid of flea and ticks, but there's definitely a way that you can keep it under control without also poisoning your dog at the same time.
Absolutely.
Man, it makes it it's so hard. I do know that going to your website, for instance, made me go, yeah, this is the type of doctor that I want. So I do think being able to research a doctor, if you hear about someone talking about a doctor, holistic or integrative, you've got to look into it because 9 times out of 10, it's a marketing term. It's something that they've learned that that they can get questions. It's a way to find their niche or be a little different. So just make sure that they truly are.
Yeah.
What other things have you learned that you've been able to bring over from your practicing with humans that you've been able to apply with your animals?
Acupressure. It's incredible
nice.
to go to the acupuncture points on pets are different than they are in humans. I have a book, I look at the map, and if my previous dog Bear had a lot of muscle spasms where he almost looked like he was going in a seizure, but it was a muscle spasm. And I can get to those points, massage those points, and all is good. Do the same thing with Brian if he's got a spot. I also, friends' dogs, if it looks like they're hung up a little bit or it just doesn't look like they're moving well, I'll get in there, get to some of the acupuncture points, especially the hips and the back. Incredible releases for them where they just relax. And the same thing along the spine, those muscles along the spine for pets, a little fascial release on either side. They dig that. The jaw, another big one that they dig. So I think why they like their ears rubbed, because you're actually getting the jaw a little bit too. So those are kind of some of the other ones. Tuning forks for certain pets. I use a lot of tuning forks in my practice.
Tell me about tuning forks. I'm fascinated. I just was reading about the research about repairing bone, like how it helps repair or rebuild bone or something like that. Tell me about tuning forks.
So it's vibrational, and so it's sound frequency based. So much like if someone's thinking about PEMF or something of that nature, it's vibration. And the tuning forks I use are an Acutonics brand. I've had them for almost 20 years now, more than 20 years. And the gold one is 417 hertz approximately. And it's the note of C, which is the harmonizing point. I will often use that or the note of F, which is my purple one. I don't have them here, unfortunately, but I will take those and I'll put them onto acupuncture points on pets. I put them on humans. My dog in particular likes it to calm. Some pets, if they've had any trauma around loud noises, it may not be the best option. So I'll often hit one, see how they respond, see what they look, what they do. And if they're cool with it and they come towards me, then we do it. I also use PEMF. I have a portable PEMF that's on a kind of a little necklace that we'll stick onto Brian or put next to him. I put on my dad's cat too, myself. And so that's another one that I'll use quite often. Red light therapy. I will carry over.
Love red light.
Yeah. Yeah. I'll carry those ones over. Those are the.
I have a veterinarian who puts my CBD on the acupuncture needles before they put them in. Yeah. It's like, oh, that's cool. I like that.
Yeah.
What are you, as a naturopathic doctor, what is like some of your favorite things that you've been able to really watch someone just get rid of or change and watch them come back to homeostasis? Because I really don't think people understand, like even talking about Brian.
Yeah.
When you went from the kibble to real food, why he's losing all that weight is because the buildup crap that is in that food, the preservatives, the synthetic vitamins and minerals. What we now know, what happens when our liver comes across these chemicals and it doesn't know what it does in animals, and I think in humans, it stores it in our fatty tissue. And that's why these old dogs have these lumps and bumps all over them, is because of this. So when you told me he lost the weight, I knew exactly what happened. And I'm not a doctor at all. I don't even have a nutrition certificate. I just know a lot about it. But to me, that's the thing. Food is medicine.
Yeah.
And that is literally, everything that you and I do, we could never reach homeostasis for a person or an animal if we don't address the diet first.
I think that's incredible. You can't, like I tell people, we have cars that are supposed to get premium fuel. And sometimes we won't pay for the premium fuel because it's expensive. And, the car's engine's designed to have that fuel. And your body's designed to have the better fuel too. And when you don't give it optimal fuel, you don't feel well. And anyone could do this experiment. We all, like most people, will go on vacation, eat all kinds of stuff, and then be like, I wonder why I feel so bad after coming back from vacation. That's what happens. And your pets are no different. And that's a thing that, we've all been brainwashed to be like, oh, don't give the dog table food. No, give the dog table food. Not your burger.
Real food is real food is real food is real food.
If it's your burger, sure. If it's McDonald's, I won't be giving it to the dog. But
exactly,
it's things like that. Like he eats what we eat now. That's just how it's turned out, because every time that I've had to divert a little bit, like whether we're camping, whether I got really busy and I had to supplement with a little bit of kibble, like it's failed on me every single time. So now it's like he gets our food, and that's just the way it is. Because
what is it? There's that phenomenon of when like you remove the toxins from your life, I remember, just learning I remember when I made the change of everything. I remember the day that I stopped eating meat, and when I went through my entire house and removed the majority of the things that I was using on myself, personal care products, because they were filled with poisons. So once you take all that stuff out, like the laundry detergent, the dryer sheets, the floor cleaner, the freaking plug-in thing, all this artificial fragrance, all of that crap. When you remove that all out of your life, you become the canary in the coal mine when it's exposed. So I just told you that I've been traveling for 2 years. And part of it was in the Airstream, which was great. Bought an Airstream because it was the only RV that didn't have something that was off-gassing the entire time. So that's why I ended up with an Airstream. Because I had already stayed in a regular Airstream, a regular RV, and got so sick and couldn't sleep and whatever. But then if I rented an Airbnb, I literally would have to rewash everything, air out everything, re-clean the whole entire house because it smelled of fake fragrance or whatever, and I will have a flare up. I am now like so sensitive to it, and I know my animals are that way too. So that is when you're like, oh, just what is it going to hurt me just giving them the little bit of kibble? Oh, there they are, start scratching again, or bumps appear or whatever it is. So it is really amazing that when you do get the shit out of your life and environment, how sensitive you are. Like now I'll be somewhere and I'll smell someone's perfume and I'll be like, oh God, I can't even breathe. Or walk into a house that has a plug-in or Febreze.
Yeah.
And I literally am like, start reacting to it. It's crazy. Does that happen to you?
Oh, I can tell before I even walk in a place if they're using a Glade plug-in or something like that. I can just smell it. You know, all of that stuff. It's repulsive.
It is repulsive. I just bought a vacuum cleaner and now they have a little thing that they've put in it to get rid of the doggy smell that your vacuum cleaner gets. Oh. So I'm vacuuming and I'm going, where is that fake ass flower scent coming from? And I had to find it because I'm like, I know it ain't anything in my house.
Oh no. Oh no. Why would they do that? I'd rather just smell dog smell.
Me too. Me too. And it is an awful smell, but that old vacuum dog smell, but it is better than a bunch of chemicals that I know are screwing my health and my dog's health up. Well, yes. I love talking to you. I had so much fun on your podcast. So please let's share that and where people can get in touch with you and follow you.
Yeah. If you guys head over to Dr. spelled out JKRAUSEND, so N as in Nancy, D as in dog.com. You can find me there, or you can find me on Instagram at Dr. Dr. Jannine, Jannine Krause, Krause. And then, of course, the Health Fix podcast. Anywhere you get your podcasts, you'll find me there. And then, of course, Angela and I have a podcast coming up there as well. So that'll be exciting for you guys to see as well.
Thank you so much. I learned so much. Everybody go find yourself a killer naturopathic doctor like this. And because remember, I know a lot of you pay a lot more attention to your dog's health, but you got to be there to take care of your dog. So you got to take care of yourself too. And what works for them works for us too, and vice versa. 100%. So go find that naturopathic doctor and be careful when you're searching for a holistic, because many of them aren't that at all. Thank you so much. Thanks for listening to today's episode. Please make sure to leave us a review wherever you're listening from. This is the best way to help pet parents like you find these episodes and get access to all our content. Follow me on Facebook and Instagram at Your Natural Dog and at AngelaArdolino.com.